I can remember it like it happened last week. My first patient that Monday morning in August 2009 was Joe. Joe was 72 years old, and he had put off going to the dentist for decades. Doc, you gotta help me. I'm hurting so bad, and I've hurt like this for weeks. I can't take it anymore. And indeed, the only reason he came that day was because his wife made him come. I put him on an antibiotic. We went over the consent forms for IV. I gave him a sedative beforehand so he wouldn't jump when I started the IV. That Monday morning, he had followed the instructions exactly like I asked. He was in PO. He brought his escort. He had an easy health history. We hooked him up to the monitors. Everything looked ideal. Even got the IV in the first stick. We're taught for older patients with sedation to go low and go slow. You see, older patients are more susceptible to sedatives than younger patients. As I gave him the drug Versed, instead of giving him 2 milligrams, I only gave 1. And instead of waiting 1 minute, I waited 2 minutes before I did anything. I watched and listened to the pulse oximeter, and with that tiny 1 milligram dose, the level went down lower and lower and lower. But I've seen this happen plenty of times before. By reflex, I tipped his head back, like you're taught with basic life support, and I reached and I turned on the oxygen. But when I turned on the oxygen, nothing happened. Nothing happened. We wear radios in the office. Get the oxygen turned on now. Somebody didn't turn it on. And I listened and waited and didn't see the oxygen come on. And finally somebody comes back on the radio and says, Doctor, all the tanks are empty. I ran and got the emergency oxygen myself. I hooked it up. I turned it on. Nothing. Every drop of oxygen in my office was gone. I did at that point what no one should ever do during an emergency. I started to panic. I lashed out at my team members, and I made it way worse. Finally, my receptionist took me out in the hall, looked me square in the eye, and she said, Doctor, you're not accomplishing anything by losing it. Get it together. And thank goodness I did, and I remembered I could give a reversal agent, and within a half minute, Joe was breathing just fine. We're taught in emergency medicine that if all the mistakes line up just perfectly, like the holes here in the Swiss cheese, you can have the perfect storm. Joe and I almost had the perfect storm that day. I now know that of those big tanks of oxygen, there was a half tank left on the previous Friday. My dental assistant called and ordered more, but she left it on. And someone earlier had left on the oxygen in the operatory. Almost exactly the same thing happened to the emergency oxygen. I realized that day we had to do something different. We needed error proofing. We had to have stability. We had to have safety. I started looking at different industry models. And why would I show you McDonald's? Ordinary food? Well, we all go back there occasionally. Why? No matter what time of day, no matter what restaurant, what location, we get consistency. We go to McDonald's, we go to Starbucks, and we order these complex orders with 2 pumps of this and no foam, and they nail it every time. How do they do it, and how does McDonald's do it? They use systems. What are systems? A system, according to freedictionary.com, is an organized and coordinated method. One of the smartest people to ever live, Albert Einstein, said, genius is taking the complex and making it simple. Aviation realized almost a century ago, when they built these planes with all the knobs and buttons, and they crashed, that they had to do something different. In this video from just a few years ago, the pilot's landing with no landing gear. It's stuck up. Yet the pilot nails it. Everybody's safe. That pilot had run flight simulations before. They had an SOP manual, a standard operating procedure manual, to know what speed they should come in, how to position the flaps. I'm told there's 2 kinds of pilots. Pilots that have landed with their gear up, and pilots that will land with their gear up. There was a surgeon in the Northeast U.S. by the name of Atul Gawande that headed the World Health Organization about 15 years ago and absolutely revolutionized medicine by applying the principles of aviation. In his book, he says that all occupations have expectations of selflessness, of skill, and of trustworthiness. But aviation adds a fourth expectation, and that is discipline. In his book, he says we're all plagued by failures, missed subtleties, overlooked knowledge, outright errors. When we look closely, we recognize the same balls being dropped over and over by those of great determination and ability. We know the patterns, we see the costs. It's time to try something else. Try a checklist. This is me flying to the last meeting that I spoke to. Yeah, right. This is me at a photo op in a cockpit of a Southwest plane. I didn't want the photo op so much. Now I used it, yeah. But I wanted the picture of this manual. This is Southwest's Quick Reference Book, their SOP manual. That approach is how everybody in the Miracle on the Hudson survived, all 70 people. The pilot, Sully, has repeatedly said it was not just him. It was the whole crew following their training, their SOP list. Now, I ask you, doctor, as you go to your next meeting and you get on the plane and you find out that the pilot didn't run their safety checklist, do you want to stay on the plane? I don't. Yet we run our dental offices like that every day. So what could these systems do if you apply them to dentistry? First, they can simplify, they can organize, they can decrease your errors. Both dental assistants and business assistants alike tell me they feel like the systems have their back. It makes them look good. If you apply the checklist to your new patient phone calls, you'll actually increase the number of patients that make it in the door. If you apply them to your new patient exams, you'll find that your case acceptance will go up. If you use them for your room setups, you can be more efficient and make it even practical to do more same-day dentistry, from hygiene, from emergencies. So let's look at a clinical example of how to apply a system. We first want to have a list of instruments and supplies that we need to bring in the operatory for the procedure. Now, would this slow down setting up? For someone that's learning, they take the time to mark everything on the checklist to show the person that is supervising them that they are learning what they're doing. But for someone that's experienced, they simply set up for the procedure, then take 15 to 20 seconds to bring up the list and make sure everything is there. You can use photos in your systems of your tray setups and of your tubs for your new assistants to learn the instruments and learn the setups. I want a new dental assistant to put burrs in the burr block. Doctor, I don't know what a GW2 burr is. It's always in the same standardized place. The photo's labeled, and you've got the table to know exactly what to put in there. I delegate my consent forms. I don't want them reading a great big long list out of the practice management system of what can happen and put the patient to sleep and waste time. I have the least number of words that the dental assistant can go over to get the consent issues covered. Then I come in the room and simply say, Dale, what questions do you have for me about the consent form? You can do the same thing for the post-op forms. You can use system checklists to open and close the office. How many of you doctors have had a handpiece disappear and you wondered if it got thrown out in the trash? Simply count the handpieces before you leave, inventory them. If the rule is if they're not all accounted for, you don't take the trash out that night. You can do these on paper, you can do them digitally, but they're going to increase your efficiency and they're going to increase your safety. So do you think that we use a checklist to make sure that the oxygen's turned on in the morning? You better believe it. You can apply this to front office as well. Your patient checkout, your new patient phone calls, your recall management. You can create lists of how to train the dental assistants and how to train the business assistants. I can accomplish it in 30 days instead of 6 months. Thank you for watching today. I hope you'll check out my speaker packet for my other presentations. And I hope I'll be at the top of your checklist for your next dental meeting. Thanks for watching.